Welcome to NSG 222, Study Session 13, Problems of Cell Proliferation. Introduction. Cancer is a renegade system of growth that originates within the human body. There are many different types of cancers, but all share one hallmark characteristic: unchecked growth that progresses towards limitless expansion. It is difficult to imagine anyone who has not heard of this illness. Most people have been affected because either they or their loved ones or friends are cancer survivors. In this study session, you will be learning about cancer, the types, detection, diagnosis, and possible causes of cancer. Learning outcomes. At the end of the study session, you will be able to discuss the epidemiology of cancer, name different types of cancer, explain how to do cancer detection and diagnosis, describe the microscopic appearance of cancer cells, highlight the causes of cancer. Epidemiology of cancer. In 2012, there were 14.1 million new cases of cancer diagnosed worldwide. In 2008, there were 12.4 million new cancer cases and 7.6 million cancer-related deaths. The World Health Organization, WHO, projected that by 2030, these figures could increase to 26.4 million new cases and 17 million cancer-related deaths. The majority of the global cancer burden is shifting from the more developed to economically disadvantaged countries. Population growth and aging are the largest contributors to the increasing numbers of cancer cases in low and middle income countries. Although cancer affects people of all ages, most cancers occur in people older than 65 years of age. Overall, the incidence is higher in men than in women and higher in industrialized sectors and nations. The 5 most common cancers worldwide are lung, breast, colorectal, prostate, and stomach. Concepts and terminologies used in cellular disorders. Carcinomas. The most common types of cancer arise from the cells that cover external and internal body surfaces. Lung, breast, and colon are the most frequent cancers of this type in the United States. Sarcomas are cancers arising from cells found in the supporting tissues of the body, such as bone, cartilage, fat, connective tissue, and muscle. Lymphomas are cancers that arise in the lymph nodes and tissues of the body's immune system. Leukemias are cancers of the immature blood cells that grow in the bone marrow and tend to accumulate in large numbers in the bloodstream. Naming cancer. Scientists use a variety of technical names to distinguish the many different types of carcinomas, sarcomas, lymphomas, and leukemias. In general, these names are created by using different Latin prefixes that stand for the location where the cancer began its unchecked growth. For example, the prefix osco means bone, so a cancer arising in bone is called an osteosarcoma. Similarly, the prefix adeno means gland, so a cancer of gland cells is called adenocarcinoma. For example, a breast Adenocarcinoma. Naming cancer. Cancer arises from a loss of normal growth control. In normal tissues, the rate of new cell growth and whole cell death are kept in balance. In cancer, this balance is disrupted. This disruption can result from uncontrolled cell growth or loss of a cell's ability to undergo cell suicide by a process called apoptosis. Apoptosis, or cell suicide, is the mechanism by which old or damaged cells normally self-destruct. To illustrate what is meant by normal growth control, consider the skin. The thin outermost layer of normal skin, called the epidermis, is roughly a dozen cells thick. Cells in the bottom row of this layer, called the basal layer, divide just fast enough to replenish cells that are continually being shed from the surface of the skin. Each time one of these basal cells divides, it produces two cells. One remains in the basal layer and retains the capacity to divide. The other migrates out of the basal layer and loses the capacity to divide. The number of dividing cells in the basal layer therefore stays the same. During the development of skin cancer, the normal balance between cell division and cell loss is disrupted. The basal cells now divide faster than is needed to replenish the cells being shed from the surface of the skin. Each time one of these basal cells divides, the two newly formed cells will often retain the capacity to divide, thereby leading to an increase in the total number of dividing cells. This gradual increase in the number of dividing cells creates a growing mass of tissue called a tumor or neoplasm. If the rate of cell division is relatively rapid and no suicide signals are in place to trigger cell death, the tumor will grow quickly in size. If the cells divide more slowly, tumor growth will be slower. But regardless of the growth rate, tumors ultimately increase in size because new cells have been produced in greater numbers than needed. As more and more of these dividing cells accumulate, the normal organization of the tissue gradually becomes disrupted. Depending on whether or not they can spread by invasion and metastasis, tumors are classified as being either benign or malignant. Benign tumors are tumors that cannot spread by invasion or metastasis. Hence, they only grow locally. Malignant tumors are tumors that are capable of spreading by invasion and metastasis. By definition, the term cancer applies only to malignant tumors. A malignant tumor, a cancer, is a more serious health problem than a benign tumor because cancer cells can spread to distant parts of the body. For example, a melanoma, a cancer of pigmented cells, arising in the skin, can have cells that enter the bloodstream and spread to distant organs such as the liver or brain. Cancer cells in the liver would be called metastatic melanoma, not liver cancer. Metastases share the name of the original primary tumor. Melanoma cells growing in the brain or liver can disrupt the functions of this vital organ and so are potentially life-threatening. Cancer detection and diagnosis. Detecting cancer early can affect the outcome of the disease for some cancers. When cancer is found, a doctor will determine what type it is and how fast it is growing. He or she will also determine whether cancer cells have invaded nearby healthy tissues or spread, metastasized to other parts of the body. In some cases, finding cancer early may decrease a person's risk of dying from the cancer. For this reason, improving our methods for early detection is currently a high priority for cancer researchers. Cancer detection and diagnosis. Some people visit the doctor only when they feel pain or when they notice changes like a lump in the breast or unusual bleeding or discharge. But don't wait until then to be checked, because early cancer may not have any symptoms. That is why screening for some cancers is important, particularly as you get older. Screening methods are designed to check for cancer in people with no symptoms. Cervical cancer screening. A screening technique called the PAP test or pap smear allows early detection of cancer of the cervix. In this procedure, a doctor uses a small brush or wooden scraper to remove a sample of cells from the cervix and upper vagina. The cells are placed on a slide and sent to a laboratory where a microscope is used to check for abnormalities. Since the 1930s, early detection using the pap test has helped lower the death rate from cervical cancer more than 75%. Should abnormalities be found, an additional test may be necessary. There are now 13 high-risk types of human papillomavirus (HPV) recognized as the major causes of cervical cancer. The U.S. Food and Drug Administration has approved an HPV test that can identify their presence in a tissue sample. This test can detect the viruses even before there are any conclusive visible changes to the cervical cells. Breast cancer screening. Breast cancer can sometimes be detected in its early stages using a mammogram, an X-ray of the breast. Mammography is most beneficial for women as they age and undergo menopause. Mammography is a screening tool that can detect the possible presence of an abnormal tissue mass. By itself, it is not accurate enough to provide definitive proof of either the presence or the absence of breast cancer. If a mammogram indicates the presence of an abnormality, further tests must be done to determine whether breast cancer actually is present. Prostate and ovarian cancer screening. The U.S. Food and Drug Administration has approved the PSA test along with a digital rectal exam to help detect prostate cancer in men aged 50 and older. Doctors often use the PSA test and DRE as prostate cancer screening tests. Together, these tests can help doctors detect prostate cancer in men who have no symptoms of the disease. Most men with an elevated PSA test, though, turn out not to have cancer. Only 25 to 30% of men who have a biopsy due to elevated PSA levels actually have prostate cancer. So, researchers are working hard to find new clues. Experts are trying to develop better blood tests that might alert people to malignancies while the cancers are still in their early stages. For example, several new blood tests for ovarian or prostate cancer are under development. Colon cancer screening. A procedure called a facial occult blood test (FOBT) detects invisible amounts of blood in the feces, a possible sign of several disorders, including colon cancer. The test is painless and can be done at home or in the doctor's office along with a rectal exam. With an application stick, a dab of a stool specimen is smeared on a chemically treated card, which is tested in a laboratory for evidence of blood. If blood is confirmed in the stool, more elaborate tests may be performed to find the source of the bleeding. Some other options include sigmoidoscopy and colonoscopy. The former exam uses a lighted instrument called a sigmoidoscope to find precancerous or cancerous growth in the rectum and lower colon. The latter exam uses a lighted instrument called a colonoscope to find precancerous or cancerous growth throughout the colon, including the upper part. Biopsy. To diagnose the presence of cancer, a doctor must look at a sample of the affected tissue under the microscope. Hence, when preliminary symptoms, pap test, mammogram, PSA test, FOBT, or colonoscopy indicate the possible existence of cancer, a doctor must then perform a biopsy, which is the surgical removal of a small piece of tissue for microscopic examination. For leukemias, a small blood sample serves the same purpose. The microscopic examination will tell the doctor whether a tumor is actually present and, if so, whether it is malignant, that is, cancer, or benign. In addition, microarrays may be used to determine which genes are turned on or off in the sample, or proteomic profiles may be collected for an analysis of protein activity. This information will help doctors to make a more accurate diagnosis and may even help to inform treatment planning. Microscopic appearance of cancer cells. Cancer tissue has a distinctive appearance under the microscope. Among the traits, the doctor looks for Step 2. Among the traits, the doctor looks for a number of irregular shaped dividing cells. Step 3. Among the traits, the doctor looks for a large number of irregularly shaped dividing cells, variation in nuclear size and shape, variation in cell size and shape, loss of specialized cell features, loss of normal tissue organization, and a poorly defined tumor boundary. Hyperplasia. Instead of finding a benign or malignant tumor, microscopic examination of a biopsy specimen will sometimes detect a condition called hyperplasia. Hyperplasia refers to tissue growth based on an excessive rate of cell division, leading to a larger than usual number of cells. Nonetheless, cell structure and the orderly arrangement of cells within the tissue remain normal, and the process of hyperplasia is potentially reversible. Hyperplasia can be a normal tissue response to an irritating stimulus. An example of hyperplasia is the callus that may form on your hand when you first learn to swing a tennis racket or a golf club. Dysplasia. In addition to hyperplasia, microscopic examination of a biopsy specimen can detect another type of non-cancerous condition called dysplasia. Dysplasia is an abnormal type of excessive cell proliferation, characterized by loss of normal tissue arrangement and cell structure. Often, such cells revert back to normal behavior, but occasionally they gradually become malignant. Because of their potential for becoming malignant, areas of dysplasia should be closely monitored by a health professional. Sometimes they need treatment. Carcinoma in situ. The most severe cases of dysplasia are sometimes referred to as carcinoma in situ. In Latin, the term in situ means in place, so carcinoma in situ refers to an uncontrolled growth of cells that remains in the original location. However, carcinoma in situ may develop into an invasive metastatic malignancy and, therefore, is usually removed surgically if possible. Tumor grading. Microscopic examination also provides information regarding the likely behavior of a tumor and its responsiveness to treatment. Cancers with highly abnormal cell appearance and large numbers of dividing cells tend to grow more quickly, spread to other organs more frequently, and be less responsive to therapy than cancers whose cells have a more normal appearance. Based on these differences in microscopic appearance, doctors assign a numerical grade to most cancers. In this grading system, a low number grade 1 or 2, refers to cancers with fewer cell abnormalities than those with higher numbers, grade 3, 4. Tumor staging. After cancer has been diagnosed, doctors ask the following 3 questions to determine how far the disease has progressed. How large is the tumor, and how deeply has it invaded surrounding tissues? Have cancer cells spread to regional lymph nodes? As the cancer spread, metastasized to other regions of the body? Based on the answers to these questions, the cancer is assigned a stage. A patient's chances for survival are better when cancer is detected at a lower stage. Causes of cancer. Cancer is often perceived as a disease that strikes for no apparent reason. While scientists don't yet know all the reasons, many of the causes of cancer have already been identified. Besides, intrinsic factors such as heredity, diet, and hormones, scientific studies point to key extrinsic factors that contribute to the cancer's development. Chemicals, e.g. smoking, radiation, and viruses or bacteria. Population-based studies. One way of identifying the various causes of cancer is by studying populations and behaviors. This approach compares cancer rates among various groups of people exposed to different factors or exhibiting different behaviors. A striking finding to emerge from population studies is that cancers arise with different frequencies in different areas of the world. For example, stomach cancer is especially frequent in Japan, colon cancer is prominent in the United States, and skin cancer is common in Australia. What is the reason for the high rate of specific kinds of cancer in certain countries? Heredity, behaviors, other factors. In theory, differences in heredity or environmental risk factors might be responsible for the different cancer rates observed in different countries. Studies on people who have moved from one country to another suggest that exposure to risk factors for cancer varies by geographic location. For example, in Japan, the rate of colon cancer is lower and the rate of stomach cancer is higher than in the United States. But this difference has been found to gradually disappear in Japanese families that have moved to the United States. This suggests that the risk of developing the two kinds of cancer is not determined primarily by heredity. The change in risks for cancer for Japanese families could involve cultural, behavioral, or environmental factors predominant in one location and not in the other. Tobacco use and cancer. Among the various factors that can cause cancer, tobacco smoking is the greatest public health hazard. Cigarette smoke contains more than 24 different chemicals capable of causing cancer. Cigarette smoking is the main cause of lung cancer and contributes to numerous other kinds of cancer as well, including cancer of the mouth, larynx, esophagus, stomach, pancreas, kidney, and bladder. Current estimates suggest that smoking cigarettes is responsible for at least 1 out of every 3 cancer deaths, making it the largest single cause of death from cancer. Other forms of tobacco use also can cause cancer. For example, cigars, pipe smoke, and smokeless tobacco can cause cancers of the mouth. Low-strength radiation. Some atoms give off radiation, which is energy that travels through space. Prolonged or repeated exposure to certain types of radiation can cause cancer. Cancer caused by the sun's ultraviolet radiation is most common in people who spend long hours in strong sunlight. Ultraviolet radiation from sunlight is a low-strength type of radiation. Effective ways to protect against ultraviolet radiation and to prevent skin cancer are to avoid going into strong, direct sunlight and to wear protective clothing. Sunscreen lotions reduce the risk of some forms of skin cancer. High-strength radiation. Increased rates of cancer also have been detected in people exposed to high-strength forms of radiation, such as X-rays or radiation emitted from unstable atoms called radioisotopes. Because these two types of radiation are stronger than ultraviolet radiation, they can penetrate through clothing and skin into the body. Therefore, high-strength radiation can cause cancers of internal body tissues. Examples include cancer caused by nuclear fallout from atomic explosions and cancers caused by excessive exposure to radioactive chemicals. Lag time. Chemicals and radiation that are capable of triggering the development of cancer are called carcinogens. Carcinogens act through a multi-step process that initiates a series of genetic alterations, mutations, and stimulates cells to proliferate. A prolonged period of time is usually required for these multiple steps. There can be a delay of several decades between exposure to a carcinogen and the onset of cancer. For example, young people exposed to carcinogens from smoking cigarettes generally do not develop cancer for 20 to 30 years. This period between exposure and onset of disease is the lag time. Viruses. In addition to chemicals and radiation, a few viruses also can trigger the development of cancer. In general, viruses are small infectious agents that cannot reproduce on their own, but instead enter into living cells and cause the infected cell to produce more copies of the virus. Like cells, viruses store their genetic instructions in large molecules called nucleic acids. In the case of cancer viruses, some of the viral genetic information carried in this nucleic acid is inserted into the chromosomes of the infected cell, and this causes the cell to become malignant. Causes of cancer. Only a few viruses that infect human cells actually cause cancer. Included in this category are viruses implicated in cervical cancer, liver cancer, and certain lymphomas, leukemias, and sarcomas. Susceptibility to these cancers can sometimes be spread from person to person by infectious viruses, although such events account for only a very small fraction of human cancers. For example, the risk of cervical cancer is increased in women with multiple sexual partners and is especially high in women who marry men whose previous wives had this disease. Transmission of the human papillomavirus (HPV) during sexual relations appears to be involved. AIDS and Kaposi's sarcoma. People who developed AIDS after being infected with the human immunodeficiency virus (HIV) are at high risk for developing a specific type of cancer called Kaposi's sarcoma. Kaposi's sarcoma is a malignant tumor of blood vessels located in the skin. This type of cancer is not directly caused by HIV infection. Instead, HIV causes an immune deficiency that makes people more susceptible to viral infection. Infection by a virus called KSHV, Kaposi's sarcoma associated herpes virus, then appears to stimulate the development of Kaposi's sarcoma. Bacteria and stomach cancer. Viruses are not the only infectious agents that have been implicated in human cancer. The bacterium Helicobacter pylori, which can cause stomach ulcers, has been associated with the development of cancer. So people infected with H. pylori are at increased risk for stomach cancer. Research is underway to define the genetic interactions between this infectious agent and its host tissues that may explain why cancer develops. Summary. In this study session, you have learnt the following. 1. Scientists use a variety of technical names to distinguish the many different types of carcinomas, sarcomas, lymphomas, and leukemias. In general, these names are created by using different Latin prefixes that stand for the location where the cancer began its unchecked growth. 2. Detecting cancer early can affect the outcome of the disease for some cancers. When cancer is found, a doctor will determine what type it is and how fast it is growing. He or she will also determine whether cancer cells have invaded nearby healthy tissue or spread, metastasized to other parts of the body. 3. Cancer tissue has a distinctive appearance under the microscope. Among the traits the doctor looks for are a large number of irregularly shaped dividing cells, variation in nuclear size and shape, variation in cell size and shape, loss of specialized cell features, loss of normal tissue organization, and a poorly defined tumor boundary. 4. Cancer is often perceived as a disease that strikes for no apparent reason. While scientists don't yet know all the reasons, many of the causes of cancer have already been identified. Besides, Intrinsic factors such as heredity, diet, and hormones. Scientific studies point to key extrinsic factors that contribute to the cancer's development. Chemicals, e.g. smoking, radiation, and viruses or bacteria. End of study session 13. Thanks for listening.